Welcome to RCR Hub. Today we have Michelle Farrell of Orlando Health. Michelle, I'm going to pass it over to you to let you tell us your title of the day.
Sure. Hi, everyone. I'm Michelle Farrell, Vice President of Revenue Management, Orlando Health today.
Today. Some titles get very short and some titles are very long.
Yes.
Okay, we're going to just jump right in. Why revenue cycle? What brought you here and what kept you here?
I had a very strange start of the career, but why revenue cycle? I think over the years, I've been here 26 years at Orlando Health, and just, revenue cycle, we get an opportunity, really a blessing to be able to work with patients before, during, and after care. And so, if anyone has a level of compassion, this is the place to be in terms of, helping patients through the real part of the financial piece of their stay. And so, for those of us that, just can't do medicine and blood, we get the chance to help along the way for what we call the second fear. And the second fear for anyone in healthcare. First, they're worried about, can I get well? Am I getting
Mhm.
well? Second is, how am I going to afford it?
Right. So, did you take a business administration classes? How did you, in regards to your college and your path?
So my undergrad was actually in something different at the time, but very translatable to this day and age. But I was in public relations with a minor in business. And so my master's degree, of course, is in healthcare administration. So it makes
Okay.
more sense now. But, in learning and just starting off in the emergency room, really entry level, once I moved to Florida, it
Right.
was just eye-opening to see what we can do to help patients navigate through this space. It is really something that, most people in the community don't really know. I mean, when they compare the experience of, I could buy a computer at Best Buy and they just give me a price,
Mhm.
and or I buy a pizza and they just, well, it's very obviously, healthcare is super different, and explaining
Mhm.
to patients how it works, what their benefits are, and that whole process of securing a claim. We talk about, we offer services to the best of our abilities, clinical wise, really on a hope and a dream that we will get paid at the end of the day from a payer. So navigating that has been interesting over the years. But, in terms of knowing what I do and things like that, it's really more about, learning as we go,
Mhm.
and getting all of the information from the associations and peers and mentors along the way.
Right. Let's talk about mentors in bringing you in 26 years ago. Mentors that were in other departments, other businesses, and said, ORMC at the time.
Yeah, started in the emergency room. Figured that's a great place to start. It was
It is.
action packed.
Yes.
Not for the the weary hearted or anything like that, because the things you see in a level one trauma center are something that kind of stay with you for a while. But I've had the blessing of having some great leaders along the way in my life that open doors for me. Were able to trust me early on in the stages, and give me more opportunity as positions opened up, and just kind of pursuing and noticing that just sometimes just the level of drive to and level of curiosity to learn and do more, doors open.
Agreed.
When you show up where you have that level of interest and humility, like, I don't really know how to do this, but if you show me, I'll get it going. And so having that type of support along the way, I think is so important to anyone in our careers. But early on, I did start out in the emergency room, and I ended up working in all of our facilities, what we call at Orlando Health, we call the original colonies, kind of where we
Nice.
were before our exponential growth.
Mhm.
Um, just putting myself out there to work in other facilities across the board, learn to take on other areas of the revenue cycle along the way. And lo and behold, 26 years later,
There
here
it
I'm at.
is. There it is.
But
Yeah.
not for, not having the, just being surrounded by great leaders along the way that have, put faith in me and trusted me to take on more and more as I grew.
So when we talk about your 26 years, let's talk a little bit about Orlando Health. And I refer to it as ORMC. Obviously, we've had children there, and I have
Yes.
a heart, and Arnold Palmer, and all of those things. So let's talk about Orlando Health and your team. How large is your team? How many direct reports? Give us a little insight into that.
So my current area of oversight is pretty much the front and the middle rev cycle, and all the way through education and self-pay patient follow-up.
Okay.
So, it's a great team. We have under my purview is probably about 700 downstream team
Wow.
members. So through all those spaces, both non-clinicians and clinicians. So I have about 70 nurses that report up through me that are in the clinical documentation review space. And so we have an amazing team. We talk a lot
Mhm.
about the support we give to each other and just that level of, you want to join us along the way on the journey, just have that level of curiosity, level of interest, because there's more to do. And if you want to join us, come on and join us because
Right.
there's plenty to do and grow. And, over the 26 years here, it's been a ride. I mean, we have seen the ups and downs of healthcare
Mhm.
industry, even within our own organization. And, the tremendous turnaround that took place when we had a new CEO come to join our organization back in 2015. And so it put us in a spot where, we are now acquiring and building and growing. So we're growing organically, we're growing through acquisitions. It's a much different place. And so most of the team, not all, a lot of the team have been with us and have shown that level of resiliency,
Mhm.
so you can get brought down, during some hard, tough times, years ago, and to turn it around and see where we are today has just been a great journey. I have a lot to be thankful for in terms of the leaders I've worked with and the organization that, has allowed me that opportunity to grow along the way.
Well, I'll just mention two things. Your CEO, David Strong. Wow, what a gentleman. What a leader. He has done so much for the organization and for the city in general. And it's just
Yes.
really fun to watch what he's doing and how you all are helping the community and grow the community. I mean, that was, started as a community hospital, correct? So,
Oh my
it's
gosh.
just
Yes.
fantastic. And your members, and your team members, uh, when you go to those team member galas, and you start the 5 year and you're like, yeah, 5 year. Then you get up to
Oh,
the 10 year. So talk a little bit about that. Your team member retention, I think, is par none in the industry.
yeah. We have a lot of loyalty here, a
Hmm.
lot of loyalty to Orlando Health. Again, because it's a great organization to work for. We have people that will have stayed here many years. I,
Hmm.
I, I could get you the exact number, but I went to the last team member anniversary gala that we do, a
Right.
service anniversary. And gosh, I could have sworn it's definitely at least in the 40s, our longest
Yeah.
tenured team member. And I can validate that number
No,
for you,
yeah,
but
it's
we're always
just
like, oh my gosh, when did they start working?
right,
Kind of
right,
thing.
right, right.
But
And it's an event that everyone's celebrated, and it's lovely. It really
oh, it's
is.
a true like decked out formal wear. Some people wearing gowns, and it's
Yeah.
it's amazing to see how we've grown. I mean, we've gone to been able to celebrate those types of celebrations in small places.
Hmm.
Now it's in like, huge party halls at hotels because we've grown so much. And I think, what we really believe in is our culture here.
Hmm. I agree.
That's I think what holds us all kind of staying. I have OH blood in my veins, at this point. And so,
It runs red, runs
it
red.
runs red. It
Yeah,
sure
it
does.
does.
It
I
sure
love
does.
that. So, is your team in hybrid, or do you have team members that are on site, or everybody
Yeah,
remote?
combination thereof. We
Okay.
have some teams that are, of course, fully on site. So, of course, parts of patient access. HIM, we still have on site our CDI team, and part of the what we call RMCM. So it stands for Revenue Management, Care
Okay.
Management, Managed Care. And those are the teams that report up to our Chief Revenue Officer, so Michelle Napier.
Okay.
So between patient access, HIM, CDI, we call it CDE for Clinical Documentation Excellence, and care management, those are the teams that are pretty much at the sites. And within those teams, we also have some hybrid work from home team
Nice.
members as well. On the back end, of course, post-COVID, it was like pedal to the floor in terms of everyone's got to work from home.
Yeah.
And so, when we did that rather quickly across more of the, the back office side of things, um, most of them have stayed home.
Okay.
We were able to relinquish a lot of real estate in
Hmm.
terms of our support teams. And they've continued to work from home. In terms of leadership, most of our executive leaders here on site, and
Nice.
we stayed on site throughout even COVID coming into the office. So, it has changed and morphed along the way.
Nice. Yes. And which it will continue to do, I'm sure.
Sure. Yeah.
Absolutely. So we talked about the growth, and then we'll kind of end with this two things. What do you look forward to with all the automation and all the technology and the people leaning forward into services and solutions? What do you look forward to seeing in healthcare revenue cycle?
I
A
mean, I
couple of
think,
things.
leaning on the technology is so important, getting to the place where, of course, everyone talks about AI and automation and all that stuff. How do we leverage, for those simple tasks that can be done by a computer and be,
Mhm.
working by exception, of course, let that go because really our team is about those critical thinking skills, like how do we move us to the place where we really are using the best and our brightest to solve
Right.
for this journey that we're all on in healthcare revenue cycle. So I think we're excited about how do we introduce some of those things a little bit more into the process so it's baked in and trusted and relied upon.
Hmm.
And so I think we're excited about that for sure. We're on Epic for a few years now, and so just continuing to maximize the efficiency of the tool
Hmm.
and get those standardizations in place. That's one big part of it for us, looking at standardization so we can have economies of scale and
Hmm.
the experience that we provide to our patients and team members could be consistent across locations. But, on the other side of it, what I'm excited for is to continue to grow our young leaders.
Hmm.
There's so much future here, and thinking about the last trajectory of your career, my career in terms of what I want to do. My legacy is just continuing to grow the next level leaders for the organization to kind of take on, and I love that part. The whole leadership development. That's my fun part. Finding those that are interested, and curious. That curiosity piece is just when you see it in someone, you're like, yes, they got it.
Yes.
So
They're bright, they're inquisitive, they use technology, they
yes,
network, all of those
yes.
things. They'll go to a website and learn everything before it's even asked. I mean,
Isn't it
it is
right? When
incredible.
you see
So
that, it's like that's the person, you're like you want to replicate that.
right, right. Yeah, you use all the disposable tools. They really do. So I'm excited about. Well,
Yeah,
I've always believed in all the internship programs, and you can see from everything that we've done and
yes,
everyone we've tried to help, that's super important to me as well. So,
for
last
sure.
words, last comments, anything you'd like to leave for your team, anything for our revenue cycle
Oh.
community, kind of A through Z. So, anything I didn't ask, anything you'd like to share?
The most important thing kind of that we didn't touch upon is just the need for relationships and building relationships, across the teams, within the teams, across spectrums. I think we succeed when we have a good, solid, pathway to relate to people and develop relationships so that they continue to grow. I don't think any of us can solve for this on our own. And that's something we speak to our team on, is get involved,
Right.
in, the associations and things like that. And so to continue to grow. I mean, I think all of the success of our team has been when we've had a solid leadership team and that has worked together and is, kind of we got together in arms. And that's how we succeed here with the great team that we have that we're proud of.
I agree with that. I mean, they'll look forward, but it's always nice to be able to text somebody and, best case.
Yes, absolutely,
Absolutely.
absolutely.
All right. Well, Michelle, always a pleasure. Thank you
So
for
here.
taking the time. I just so appreciate it. And I know our community wanted to get to know you, and a lot of folks know you. And it's been my pleasure. So
Same here. Thank you so much.